Wounds don't heal without oxygen. So many of the simple things that happen at the microscopic level when it comes to wound healing are oxygen-dependent processes, so they can't happen without a good oxygen supply to the tissues. There are a couple of different ways that hyperbaric therapy can treat wounds, that is, in addition to good wound care that you would see in a wound care clinic or at the GP practice. Hyperbaric therapy causes a reduction in inflammation. It's also giving tissues that don't have a very good oxygen supply a spectacularly high oxygen supply for a short period of time. And over the course of many treatments over weeks, we start seeing new blood vessels developing. So what we're doing is we're improving the blood supply to the tissues that traditionally don't have a good blood supply. And by doing that, we're giving them the ability to then be able to heal themselves. Hyperbaric oxygen therapy by itself will not treat a wound. So you must have hyperbaric oxygen therapy in combination with really good wound care, really good nutrition, exercise, and a lot of other mainstays that come into play when we're managing wounds. Not all wounds are suitable for hyperbaric therapy. The two most common conditions that we see are patients with diabetes mellitus that have ulcers that don't heal, often on their feet, and also in patients who have previously had radiation to manage cancer, where that irradiated tissue doesn't have a very good blood supply because of the radiation damage to that normal tissue. Those are the two most common we see. There are other medical conditions that can be treated with hyperbaric oxygen therapy, but these aren't as common. The environment that we have at this particular facility is fantastic. The staff are beautiful, the patients are lovely, and it's a really dynamic, fun day where there's never a dull moment, and that's absolutely the thing I like most about working in hyperbaric therapy. There is nothing more satisfying as a clinician to see someone with a medical condition that gets better, and we absolutely find that going through the journey with patients with regards to their wound healing, seeing them get better, seeing their quality of life improve, and seeing them be able to do activities that they haven't been able to do with an open wound is really satisfying.